So, you're trying to conceive, and you might have come across this term that can cause a whole lot of confusion, and let's be honest, anxiety. Late ovulation. Today we're going to break down exactly what it is, why it happens, and what it really means for your chances of getting pregnant.
You're waiting, you're wondering, is my period just late or could I be pregnant? It's such a frustrating place to be. But the answer might not be what you think. It could all come down to a simple shift in your body's timing, and that's what we call late ovulation.
So, to really understand what's happening, we've got to go back to basics and look at the main event of any menstrual cycle, ovulation itself. It's actually pretty straightforward. Ovulation is simply the moment when one of your ovaries releases a mature egg. This is the absolute most crucial event in your cycle because, well, without an egg, pregnancy just can't happen. It's the starting gun. This right here really helps clarify the timing. Okay, so in a textbook 28-day cycle, ovulation happens like clockwork, right in the middle, around day 14. Pretty predictable, right? But with late ovulation, that whole event gets pushed back. It might not happen until day 20, or maybe even later. And that single shift is what makes everything feel so unpredictable. So why does this delay even happen? Well, it's not just random. There are actually a few really common and totally understandable causes. You know, your body's rhythm can be surprisingly sensitive. Stress is a big one. I mean, really big. High levels of the stress hormone cortisol can basically tell your body, hey, this is not a safe time to conceive, and that can delay ovulation. Hormonal imbalances, which are sometimes linked to conditions like PCOS, can also disrupt the delicate signals your body needs to release an egg. And for some people, it's just their natural pattern to have irregular cycles. Okay, so we know what it is and why it happens. But here's the million-dollar question. How does this delay actually impact your chances of getting pregnant? So here's the crucial point. Because your egg is released later in your cycle, the entire window for fertilization, that perfect time when sperm can meet the egg, also gets pushed back. It's like a simple but really important domino effect that changes the entire timeline. And this explains so much. It's why you might get a negative pregnancy test even when you feel like your period is late. See, pregnancy tests detect a hormone called HCG, which your body only starts producing after a fertilized egg has implanted. So if that whole process is delayed, then the production of HCG is delayed too, and that means a positive test result will also show up later than you'd expect. Now, I know this might feel a little overwhelming, but really, this knowledge is power. So what can you do about it? Let's look at the path forward. Before we go any further, I want this message to really sink in. Late ovulation does not mean pregnancy is impossible. It simply means your body is on a different schedule, and understanding that schedule is the key. So what does this mean in practical terms? Well, first, try to resist the urge to test on the day you think your period should start. I know, it's so tempting. Instead, try testing about 12 to 14 days after you suspect you might have ovulated. This shifts your focus from a rigid calendar date to your body's actual timeline, and it gives those pregnancy hormones enough time to build up to a level the test can actually detect. Ultimately, it all comes down to this one powerful tool: knowledge. Understanding your own unique cycle is the absolute key. You can do this by using things like ovulation predictor kits, tracking your basal body temperature first thing in the morning, or just noticing changes in your body. These methods help you pinpoint your actual ovulation day, replacing all that guesswork with real data. And that brings us to the end. We've seen that late ovulation isn't a dead end, not at all. It's just a different timeline. So the final question is really for you. Now that you understand your cycle a little bit better, what will your next step be? Maybe it's trying a new tracking method, or maybe it's just giving yourself a little more patience and grace. Whatever you decide, the power is now in your hands. Thanks for joining me.